Hello, everyone. I want to thank you for joining us for our talk today with Stephanie Ramirez on communication after a stroke, tips for caregivers and patients. Stephanie is a speech language pathologist here at North Kansas City Hospital. She's been here since 2009 in various settings, primarily in acute care and outpatient rehab with adults. Stephanie founded the Brain Injury and Support Group in North Kansas City Hospital here in 2021. Yeah.
Yes.
It meets monthly and served over 45 individuals from Missouri to California, all recovering from concussions. I think I'm having a concussion. She is passionate about sharing information with the community and has been a featured speaker at several conferences, including KU Concussion Symposium, the STEM Saturdays at Union Station, and the Kansas Speech and Hearing Association. Stephanie enjoys spending time with her husband and our two children, Owen and Mia, and rooting for her alma mater, the Oregon Ducks. They're the ones with the cool uniforms, right?
Yes, they do have the cool uniforms.
Gray and green.
Yes.
Yeah, I always like that. I'm going to turn it over to Miss Stephanie.
Thank you.
Any questions, please pipe up. She is very open, and look forward to hearing your talk.
Thank you. Thank you so much. Yeah, we had Phil Knight, who is the founder of Nike, went to Oregon. So we call him affectionately Uncle Phil. And yes, he hooked the Ducks up with some pretty awesome uniforms over the years. So thank you so much for having me. I'm really excited to speak on this topic because I think it's one that's very important. So let's just jump right in. So what I'm going to be discussing today, I'm going to talk about, first and foremost, what is a stroke? And then what are some common changes that individuals may experience in their communication after a stroke? What can communication partners do to help? And then hopefully also leave you with some other resources that are out there in the community that could potentially provide some assistance and support. So first of all, a stroke is defined as when the blood supply or to part of your brain is interrupted or reduced. That prevents the brain tissue from getting oxygen and nutrients. You might hear it called a CVA, which is short for cerebrovascular accident. You might hear it classified by the type of stroke that it is. So there are three main types. Ischemic strokes are when the blood vessels become narrowed or blocked. Hemorrhagic strokes are when a blood vessel in your brain leaks or ruptures. Blood is actually toxic to brain tissue. So if it gets out in the brain area, that can be very damaging. And then finally, you might also hear transient ischemic attack, or TIA. You might also hear that called a mini stroke. And that is basically a temporary period of symptoms similar to someone having a stroke, but they have not had what has been determined to be a full-blown hemorrhagic or ischemic stroke. Now, people that have had a TIA are definitely at increased risk for having a stroke in the future. So just because you did not have a full stroke doesn't mean that you're not at risk. When we're thinking about a stroke, the acronym that I'd like you to remember is be fast. So looking for things like balance difficulty, eye changes or vision changes, facial drooping, arm weakness, and speech difficulty. If you notice any of those things, it's definitely time to act because with a stroke, time is of the essence. Now, interestingly enough, the signs of a stroke for women can include other things. So things like seizures, hallucinations, confusion, behavioral changes. Even hiccups can sometimes be a sign of a stroke in women, obviously accompanied by other things, not just hiccups alone. Sometimes women might experience difficulty breathing or shortness of breath and nausea or vomiting. So just because you don't have a facial droop, but if you have other signs and symptoms and you're starting to notice these types of patterns, it's definitely time to go get that checked out. Now, when you have a stroke, depending upon which side of the brain is impacted, you will have different symptoms or results, if you will. And those symptoms typically affect the opposite side of the body if you are talking about physical changes. So if you have a right hemisphere stroke, the left side of the body might have weakness or paralysis. If you have a left hemisphere stroke, you'll notice those changes on the right side. As far as your brain function, when you have a right hemisphere stroke, you might notice changes in attention, impulse control. You might notice difficulty with vision, difficulty even with facial recognition, changes in emotional stability. So that person might become really irritable, and some, kind of depth perception changes, because those are the things that are controlled by the right hemisphere of the brain. The left hemisphere of the brain is where we see most of the language components of a stroke. So if the stroke happens in the left hemisphere, you will notice changes with motor speech, expressive speech, math, writing, again, that reading numbers, letters, remembering written information. You might also notice some difficulty with emotion control there as well. If it's towards the front of the brain, the frontal lobe is where we basically have our command center, our personality. And so if the frontal lobe is affected, you will still notice some of those emotional changes, regardless of what side the stroke happens on. So these are just kind of general things. Of course, everyone is different. Everyone has, a different response. Some people can have, a stroke in the same part of the brain and have completely different symptoms. So I think it's really important to make sure that you're getting a thorough workup by your physicians and by your therapist to see what areas really were impacted and what could benefit from some work. So again, if the stroke is happening in the left side, we're going to expect some communication changes. Aphasia is one change in communication that you might notice, and this is actual changes in language ability. So the ability to word find, the ability to comprehend language. So aphasia actually is classified as different types depending upon, again, where in that left hemisphere you have the stroke and what your symptoms are. So these are some terms that you might hear thrown around, and each one of them has a different set of symptoms that you can expect. So for example, Broca's aphasia, a lot of times these patients don't have any trouble understanding language, but they have trouble getting the words out. They know what they want to say, but they just can't think of the word. So their speech might be very halting. They might, just speak in 1 or 2 word utterances because they just can't think of the words. Whereas Wernicke's aphasia is kind of the opposite, where they can, they might have some trouble understanding speech, and even recognizing that their own speech is not, you can't comprehend it. A lot of times these patients have what we call word salad, where they just are kind of speaking in these long, kind of drawn out phrases, but it's nonsensical. You can't understand what they're saying. Other types you might have are transcortical aphasia, conduction aphasia, mixed aphasia, and then finally global aphasia. That is where both the expressive language, the speaking, writing, and receptive, listening, reading, comprehension are affected. So both. So again, a person with aphasia might speak in short or incomplete sentences, or speak in sentences that don't make sense. They might substitute one word for another or one sound for another. Some of the words might be unrecognizable, or they might have long pauses as they have difficulty finding words. Depending, again, they might have trouble understanding conversations or what they read. And typically, what we notice is that their writing is a reflection of their speech. So if they're having trouble with word finding, they might sit holding the pencil for a really long time before they can get that word processed. Or if they are kind of doing some nonsensical speech, they might be writing, but it's really not making any sense. So typically the writing is a reflection of what you're seeing in their speech as well. So aphasia, I want you to remember, is the language piece. Apraxia is a change in the motor ability, and that's caused by damage to different brain motor pathways. And so in this case, they know exactly what word they want to say, they can understand, but they just can't get the muscles to do what they want them to do. So a person with apraxia of speech might distort the sounds or have trouble pronouncing words correctly. Usually for these patients, longer and more complex words are usually harder to say. You might notice more breakdowns as the words get longer or the phrases get longer. You might have sound substitutions. So instead of potato, they might say birdato. So it's close, but it's not quite there. The muscles are just not working the way they're supposed to. A lot of times these errors are more inconsistent, and they might be kind of groping. They might try several different attempts before they get the right thing to come out. And sometimes you notice changes in the tone, stress, or rhythm of their conversation as well. So aphasia is the language impairment. Apraxia is a motor impairment. And you can also have apraxia of your limbs as well. So apraxia can affect not just speech, but also movement in other parts of the body. And then finally, dysarthria is a change in speech clarity, and that's due to weakness or paralysis in the muscles. So this, instead of having the completely wrong sound come out or distortion, you might notice more of a slurring of the speech, and that's from weakness. So people with dysarthria might have difficulty moving their mouth, tongue, or lips. You might notice their speech is more slurred or slow. They might have more difficulty controlling their volume. And if that weakness goes into their soft palate, you might notice that their voice is more nasal sounding. You might notice some hesitations or speaking kind of in short bursts when they get that strength built up. So dysarthria is the clarity of the speech that's impacted. So those are the three main communication changes that you might see after a stroke. And again, each one can be presenting in various degrees of severity. So some people might have very mild symptoms, and some people might not be able to speak at all, just based on the severity of the stroke, where it occurred, and what parts of the brain were affected. So communication tips I'm going to teach you today. Obviously, you can adapt these based on what the person needs, but these are just kind of laying the foundation for creating an environment that's going to be more conducive to communication. So number one, when you're talking with a person who's had a stroke, you really want to set up your environment for success. It's not going to go well if there's a lot of people talking at the same time, the person can't see you, there's a lot of distractions, there's just too much going on. So ideally, you move to a quiet space that minimizes those background noises, distractions. You're in a place that has really good lighting so you can see each other's faces. I think, and we'll talk more about this in just a little bit, that nonverbal communication, facial expressions, gestures can be very helpful. And so if you can't see the other person very well, then that is lost. Speaking face to face is also ideal rather than trying to have, long conversations on the telephone. A lot of times people report a lot of difficulty talking on the phone. And like I just said, nonverbal communication, very, very important and helpful. So what I suggest is especially if you have somebody who is having a lot of trouble communicating, have a notebook or a whiteboard close by that you can utilize. You can have the person try to write down keywords, or you can write down keywords to check that you're understanding what they're trying to say. Gesturing is always, helpful. Drawing, if they can't write the words, sometimes they can draw what they're trying to express. Pictures can also be very helpful. So in the hospital, we have picture communication systems that we have available for patients if they're having trouble communicating. And they have just basic symbols for those common needs in the hospital, such as pain, needing to use the restroom, wanting a drink or something to eat. You can certainly create one of those yourself. Sometimes if you're having a conversation about a specific topic, for example, I had a patient who was coming to me and we were working on his speech, and he really, really liked hunting. And so I had him bring in a magazine that was a hunting magazine. And so we used that as we were having our conversation. He could flip to different pages that had different pictures of things that had to do with hunting if he couldn't come up with the exact word himself. So it was just there kind of as a backup, a supplement for him to use. So magazines, newspapers, those can absolutely be used as communication tools. And, as far as that goes, those are all pretty low tech options. There are just paper. There are higher tech options out there if someone is having more trouble. Tablets, different communication devices, and those would be things that person could be evaluated for. And if they would benefit, a lot of times those are covered by insurance. So we can work with people on that. Ability KC downtown also does a lot of training with those communication devices as well. So it can go all the way from just a paper and pencil to a very sophisticated computer assisting someone to talk. My third tip for communication is to keep it simple, but age appropriate. So one of my pet peeves is when a person is having difficulty communicating after a stroke, and then their friends or family start talking to them like they're a child. That is not going to make things any better. In fact, it's probably going to make them quite frustrated. I always tell my patients, just because your brain has had an injury and you're recovering from that injury, it doesn't mean that you've lost who you are. It doesn't mean that you've lost your intelligence. All of that information is still there. It's just their ability to access that information that's been impacted. So it's still the same person. They're just having trouble accessing that information. So you don't have to make things like you would for a child, but just shortening phrases, maybe repeating information. So if they're having trouble comprehending, you might just repeat that key word, and you might slow down just a bit so they can have time to process that information as well. Sometimes modeling different sounds, especially when you're talking about apraxia or dysarthria, where that motor component is there, can help the person kind of formulate that sound for themselves. A lot of times I tell my the families of my patients that it is up to their family member whether they would prefer that they jump in with the word if they can guess what they're trying to say, or if they would rather them wait and give that person time to get it out themselves. Because I think it's a definitely a personal preference. Some people want you to kind of jump in and help, and then for some people that's very annoying. So I think it again is a case by case basis, and I think it's a good conversation to have. Do you want me to say the word if I think I know what you're trying to say, or would you rather me wait? And they can kind of tell you what their preference would be. Next, my strategy is to review. So make sure you're asking questions as you go along that you can verify whether you've understood them correctly. That way you know if you're on the right track or if maybe you need to start back over again. If you change the topic of conversation, I think it's sometimes helpful to clarify, okay, we're talking about something different now. So you're not still stuck on that same previous topic when that person's moved on. You might recap the conversation at the end just to make sure that you are taking away what that person wanted. And again, if that person is comfortable, you can sometimes give hints. Some people find that getting the beginning sound of the word can help them get the entire word out. So again, going back to the word potato, if the person is having trouble getting that sound or that word out, you can say, well, it starts with the P sound, huh, huh, and then they can get the potato, the rest of the word. Sometimes you can kind of put that word into a sentence. So, you know, with my steak, I like to eat a baked potato, and then they can kind of fill in the blanks. So sometimes that can also be helpful. Again, I think it's a personal preference if people want you to do that or not, but that is something that can be helpful. And I think the next one is very important. It's going to be a test of patience at first because it is going to be different. It's very important to give the person extra time to respond. Sometimes just giving them a little bit of extra time, and it might feel kind of uncomfortable because we're so used to having very fast conversations and kind of moving on to the next topic quickly. So that silence at first might feel uncomfortable, but that could be just what they need to kind of formulate and find those words that they need. It can help with a lot of frustration as well. Because a lot of my patients tell me, you know, I feel like people kind of talk over me and they don't wait for me to get what I want to say out. So a lot of times I will tell my patients at the beginning of a conversation, particularly if it's with someone who's not familiar with you, you might have to specify, you know, I've had a stroke, please give me extra time to respond. And, you know, just kind of setting that expectation at the beginning. Again, taking turns, making sure you're not talking over the person and they're having a turn to say what they want to say. Offering positive reinforcement, it can be incredibly frustrating to try to communicate after a stroke. So I think a lot of people tend to just try to avoid conversations or talk less or kind of pull back from those situations. But if they can be part of it, number one, they're getting, you know, that socialization, which is so good for your brain and for recovery. And, you know, number two, they're able to get their needs met. And so it just improves quality of life. So really giving that person positive reinforcement, encouraging them to participate in conversations and participate in social situations, that would be great. And then finally, you know, sometimes there's going to be moments where the word just does not come, and you've tried different strategies, you've tried writing it down, you've tried figuring out the first letter, you've tried, you know, giving those hints, but it's just, you're just not getting it. And that happens. I mean, it is not uncommon. So I think the main thing is it's going to be harder for that person to come up with what they want to say if they're frustrated or emotional. So taking a break and coming back to it later sometimes is what you need to do. And so that can be, you know, just a couple minute break, or it can be like, you know, a couple hours, but just taking that break, letting everybody kind of calm down. And then maybe you might give that person time to explain it in a different way where they can get what they want to say out. So those are a lot of good tips if you are the communication partner. If you are the person who had a stroke, these are some of the strategies that we talk about in therapy a lot that can be helpful. So if you're trying to think of what word you want to say, you might get a mental picture of that. So try to think, you know, what does it look like? Is it big? Is it small? What does the word start with? You know, let's say the word is coffee. So, you know, I might picture that cup of coffee. I might even, you know, make a cup motion with my hand that could help get what I want to communicate across. You might describe it. So, you know, what category does it belong to? What is it used for? Where would you find it? So, you know, I might say, well, you know, it's that hot liquid that I drink in the morning that has caffeine. It helps me wake up. And then, you know, whoever I was talking with would probably guess that I was thinking about coffee. And then finally, saying the first sound out loud. Again, this can sometimes help kind of that domino effect to produce the rest of the word. So in the morning, I drink a cup of coffee. And so kind of just getting that, the rest of that word out by using that first sound. Some other ideas to promote language after a stroke. A lot of times, interestingly enough, even if someone has trouble thinking of words or pronouncing words, singing a lot of times is intact. So you could do some singing, even if you know, you're not a very good singer. I tell my patients nobody needs to be, you know, Celine Dion, but it's just a matter of practicing those motor patterns for your speech and kind of getting practice there. There are a lot of really language rich games out there, board games, you know, card games, things that you know, you have to guess the words. So the first one that comes to my mind is Scattergories. So if you've ever played the game Scattergories, you have a letter, and then there are different lists of categories, and you have to think of words in those categories that start with that letter. So it's a fun game. It's a way you can, again, kind of socialize with other people, but also be kind of working on those skills that are going to help make your, you know, neural pathways in your brain recover and work stronger. Talking about enjoyable topics. Again, I had a patient who loved hunting, fishing, all things outdoors. And so every time he came in, we had a conversation about that because that was something he enjoyed. I think, you know, talking about topics also that are familiar to that person, it's going to be easier than trying to have a conversation about something that they're not very interested in or familiar with, because those words are deeper rooted in their brain. So thinking about things that they enjoy, and then maybe creating some of those communication aids, like I talked about, the pictures, the, you know, words written down that they could point to. Sometimes, you know, having the alphabet kind of typed out, they could also point to the letters, or again, depending on the topic, you might have some keywords printed out that they could use to help supplement their conversation. And then finally, if you're, you know, struggling, considering speech therapy, which is typically covered with a doctor's order, we work on all of these things and we try to make it enjoyable and individualized to each and every patient. And I will say, I don't think it matters where you are in the recovery process. I have worked with patients who were literally just discharged from the hospital yesterday, and I've worked with patients who had a stroke 10 years ago, and they just want to, you know, work more on their language. I know there is kind of this like, you know, philosophy of like this window of recovery after a stroke. And I do think that a lot of recovery does happen in the first months to the year after a stroke, but that doesn't mean that after that year, that person can't make any more progress. So I think it's, you know, it's appropriate for anybody. And I think it's helpful too if you've had therapy in the past, but you haven't had it in a while and you want to come back and kind of get some new information and new exercises. We also really encourage family members to come as well. So it's kind of training both of you to work together and try to just improve quality of life and quality of communication at home. So in speech therapy, I like to tell people we kind of work everything from the neck up. So we do work on language, speaking skills. We look at other forms of communication, like I was telling you about earlier. So whether it's something that's going to be high tech or low tech, whatever is going to be most helpful. We can also address cognitive deficits such as changes in memory, attention, problem solving, things like that, which also might change after a stroke. And we can also ensure safety of eating, drinking, and swallowing. That's another thing that happens after a stroke. You know, if those muscles are damaged, sometimes the coordination that's required for swallowing is impacted. And so every person that comes into our hospital, if they are seen for a stroke, will have a swallow evaluation done, because it is something that is pretty common. And believe it or not, swallowing is one of the most complicated things our body does. And we do it, you know, in a split second, hundreds of times during a meal. So if something isn't going right, it can quickly lead to a problem if things are going down the wrong way. So we can check all of that to make sure that person is safe, and then work on any areas where they might be needing help. And just to kind of give you a little information about us, we have 6 outpatient speech pathologists working here full time. And then we have 6 inpatient acute speech pathologists as well. We have 3 locations now, and those are listed up there. So we have our main hospital campus. We also have offices at Creekwood and North Oak Medical Park. And like I said, we are covered by most insurance companies with a doctor's order. So if you'd like to learn more, you can absolutely give us a call. And so if you're just getting started in this process, or if you're considering going back to therapy, I think it's important to think about some ways that you can get the most out of rehab. Ideally, we do like to start with patients quickly, just because I think it can help get you on the right track, and just help, again, reduce that frustration if they're having trouble communicating. I think, again, like I was talking about, that recovery plateau kind of myth, you can recover and make progress no matter where you are in your journey. I think it's helpful to recruit support. Again, I said we encourage family to be involved. Anybody who is part of that patient's life can definitely be there for support and to learn, because I think the more support that person has at home, the more carryover there will be with the exercises and the strategies. So as much support as you can, kind of recruiting that in the beginning. Do the work. So unfortunately, there's no magic pill that we can give people that'll help their communication improve after a stroke. But there are exercises, and we will give those to you. And those might be language exercises if that's what you're having trouble with. It might be exercises to strengthen the muscles or to improve your coordination, just whatever you're needing. But you will have to do it to see an improvement. So generally, I tell people, try to think about, you know, your therapy exercises, kind of the same way you think about physical exercises for your legs or your arms. You know, the doctors tell you try to get 30 minutes of physical activity 5 days a week. And so I tell my patients, shoot for that for your brain as well. A lot of emotional changes happen with a stroke. It's a huge life change in a lot of cases. I also tell my patients, I realize that nobody's in my office because something good happened. So there is a lot of depression and anxiety that can happen after a stroke, which is absolutely completely understandable and very common. But I will say, if those go unaddressed, patients are struggling more than if they try to get a handle on them. So maybe talking to their physicians, seeing if they can talk to a counselor, or if they can, you know, get on some medication to help with that. Typically, those patients do better when they have kind of their mental health looked after as well as their physical health. And then finally, when you have one stroke, you're at an increased risk to have another. So taking the steps in your lifestyle to try to prevent another stroke, and working closely with your physicians on, you know, taking the medications you're supposed to be taking, diet, exercise, all of those things that are going to help just reduce your risk for another stroke. There are other resources out there which I wanted to share with you all. So the American Stroke Association has a lot of awesome resources. They have a website that you can check out. The Whole Person is an organization that has different resources out there that can help individuals who have any kind of disability get support so that they can live as independently as they possibly can. So I encourage anybody interested to check those out as well. The Acute Rehabilitation Unit here at North Kansas City Hospital offers a free stroke support group. And I included the information. That support group is free, and it meets the third Tuesday of each month. And you can join in via Zoom, just like these presentations. So I've got the information there. If you go to the North Kansas City Hospital website and look up classes and events, it would be listed under the stroke support. And so finally, I was going to leave you with my information. If you have any questions about communication, about strokes, about therapy, I'm more than happy to be a resource, answer any questions that you may have. But hopefully you learned some things today that you can take into your weekend and your holidays to make those family times and communication even better. So again, thank you for the opportunity to talk today, and I think that's all for me.
Question, Stephanie. You mentioned pulling in games.
Yes.
I love that. And then I'm thinking about apps. Are there any apps that you know of that are specific for speech therapy, maybe after a stroke?
Absolutely. So there are a lot, actually, and it depends upon kind of the level that you are, you know, wanting. I have actually a really good list of apps that I would be happy to send out. And I was trying to see if I had it on my desk here, and I might not have it immediately available. But I have it, a list of apps, and I've got it organized by kind of level, so easy, medium, and hard. There are different programs. One of them that I will kind of plug because I really like it and it's free, is a program by the company Lingraphica. They have an app that you can get on an iPad, or you can get it through just your web browser on your computer. It's called TalkPath, TalkPath, TalkPath. And so to access it on a computer, you'll go to therapy.aphasia.com, and you can sign up for a free account. It will ask for some demographic information because I think they want to know who's using the program. But there are tons of exercises and games on that program that you can use. Motor, speech, language, cognition, you name it. And so it's really great. I think a lot of my patients have used it and have really appreciated having that kind of resource. Because I tell people, when it comes to exercising your brain, variety is really good. So if you're, doing some maybe word puzzles, then maybe the next day you are on the computer doing the Lingraphica program. And then the next day you are going out to lunch and having a conversation with a friend. So doing different things every day and having those apps or that computer program that has hundreds of, exercises can help make that a little bit easier. So that's Lingraphica and TalkPath would be the main one that I would recommend, and it is free.
Always, you can email Stephanie too if you want a list of other apps. I think that's a great option.
Yeah.
This might be a hard question to answer, but do post-stroke victims, do they recover that speech fully? Or like, what do you normally see?
Yeah, I think, again, it completely varies. So I have had patients where they come in and they recover, I would say 99.9%. They might feel like maybe it's a little bit different, but anybody who was talking with them would never know that they had a stroke. And then, there are people that will recover, but not fully, or have to have some kind of strategies on board to help them. So I think it just depends on a lot of factors. But the main thing is, where was the stroke and how extensive was the damage? And again, going back to the very beginning of the talk, I think being aware of the symptoms of a stroke and responding as quickly as possible is going to give you the best chance, because there's so much more they can do if you are within a specific window of time of those symptoms. The neurologist can go in and they have various treatment options. But if you go, outside of that window, then there's not as much that they can do.
That think fast.
Yes, be fast.
One more question.
Yeah.
Us gals, us women, we always display symptoms differently. With heart attacks, we have different symptoms. Do you think that that's related to hormones?
I'm not sure. I think it's a good hypothesis. I also don't know if it's because the research historically has been conducted by men on men. So a lot of those things that we see, and this applies to, like you said, heart attack, but concussion as well. Concussions present differently in women. And so I think hopefully, as more women become doctors and researchers, we might be able to kind of expand that knowledge base. But it could absolutely be a combination of, hormones and just, how our body reacts differently to different traumas.
To ignore symptoms, which we all do.
Yep. Tend to kind of put our own symptoms on the back burner while we worry about everybody else. So.
Well, I want to thank you, Stephanie, viewer, for tuning in and listening. Remember that Stephanie's email is up there on that page and her phone number. And you can always check back for more events and classes at nkch.org/class. My name is Bree Kimberly from North Kansas City Hospital Community Health and Wellness, and we thank you and have a great holiday.
Thanks.